Good day, respected panelists, instructors, and classmates. We are the researchers from Level 3D Nursing, and today we are here to present our research entitled The Impact of Teaching Intervention with the Use of Artificial Intelligence in Enhancing the Academic Performance of Level 2 Student Nurses. Our study primarily aims to determine the effectivity of using artificial intelligence or AI on the academic performance of second-year nursing students. Next slide, please. Together with me is Ms. Rabago, Ms. Ramos, Ms. Rama, Ms. Rio Florido, Mr. Samiliano, Mr. Sanchez, and Ms. Tabuada. For our overview, we have the SOP, research instruments, advantages and disadvantages, and the evaluation of the instruments. For our statement of the problem, specifically, it seeks to answer the following questions. Number 1 is what is the average grade of student nurses in the following subjects? First is NCM 106 and Pharmacology. Second, NCM 107 and Care of Mother, Child, and Adolescent. And this allows us to determine the student's baseline academic performance before the teaching intervention. Second, what is the extent of AI use as part of the academic preparation of second-year nursing students in the same subjects? Here, we aim to measure how often and how deeply students integrate AI tools in their study routines, such as for assignments, exam reviews, and class recitations. Number 3, is there a significant relationship between grades of student nurses and extent of AI? And this determines if there is a meaningful connection between how students use AI tools and their academic outcomes. And lastly, based on the result of the study, what program can be developed? These final questions focuses on creating a sustainable educational program that promotes responsible AI use among nursing students. And though these questions, we aim to connect AI usage, academic performance, and responsible learning behavior into one framework. To explain further the development and advantages, and also the evaluation of these instruments, let me now turn over the discussion to Ms. Van Erin Rio Florido.
So for our research instruments, we utilize two research instruments, which are the achievement test and the structured questionnaire. So first, for the achievement test, it specifically the midterm and final examinations in NCM 106N and NCM 107N. So these teacher-made tests were designed by course instructors based on the syllabus and intended learning outcomes. The midterm exam consists of 80 multiple choice items, while the final exam consisted of 100 multiple choice items that assess both the knowledge and application of nursing concepts. The midterm examination served as the pre-test, while the final examination was used as the post-test to measure the effect of the teaching intervention on academic performance. So the validity of the instrument was established through expert review by nursing faculty to ensure content alignment with curricular standards, while reliability was supported by institutional item analysis procedures that examine the quality of test items.
For the structured questionnaire on responsible use of AI, this type of self-developed assessment tool which consists of 20-item multiple choice questionnaire. The purpose of this is the primary aim of this tool is to evaluate nursing students' knowledge, awareness, and attitudes toward the responsible use of artificial intelligence. In their academic and clinical training, the questionnaire is administered for both pre- and post-intervention, enabling measurement of changes in understanding and perception following an educational activity or intervention related to AI. The domains covered are understanding AI, which is the foundational knowledge of AI, including the definitions, types, and real-world examples relevant to healthcare and nursing education. Responsible use of AI tools in academic settings, including limitations, risks, and appropriate scenarios for usage. Next is the ethical considerations, which explores of academic integrity, particularly in relation to plagiarism, authorship, and appropriate citation of AI-generated content. It emphasizes on preserving critical thinking and professional judgment when using AI tools. Evaluation of ethical dilemmas that may arise from misuse of over-reliance on AI in educational and practice. Next is the practical applications. This assessment of students' familiarity with AI tools designed to support learning such as AI-generated flashcards, summaries, and quizzes and simulations. The validation process is to ensure that tools' content validity and clarity. The questionnaire underwent expert review by 3 experienced nursing faculty members with backgrounds in nursing education, ethics, and informatics. Administration, the questionnaire is distributed via online or survey platform. Next slide, please.
For the instrument to be used, we have the achievement test. The achievement test is the study utilized the achievement test to measure student academic performance before and after the intervention. So the midterm examination that taga-consist siya ng 80 multiple choice question is yun ang nag-serve for pre-test, while the final examination naman is nag-compose siya of 100 multiple choice question and yun yung post-test. So both tests were teacher-made assessment developed by the subject instructors to ensure the alignment with the course syllabus, intended learning outcomes, and the cognitive demands of the subject matter. The test items were designed to assess the range of cognitive skills, recall, comprehensive application, and analysis based on Bloom's taxonomy. Content validity was established through expert validation by the subject matter specialists to verify that the items adequately cover the topic taught with the course, and the reliability of the test was determined through a pilot testing procedure where item difficulty and discrimination indicates were analyzed to ensure test consistency and appropriateness. So the pre-test provide a baseline measurement of student knowledge and skills prior to exposure to the intervention, while the post-test naman, the degree of learning improvement or achievement after the intervention. So the second is a structured questionnaire, or a research-made questionnaire was employed to assess student knowledge, attitude, and perception regarding the use of AI in their learnings. So the questionnaire consists of 20 multiple choice items systematically divided into three domains, which is the understanding AI, ethical consideration, and practical application. As understanding AI, this section measures student fundamental knowledge of AI, including in definition, common example, and the concept of responsible use of AI in academic context. While sa ethical consideration naman, this part is focused on evaluating the student awareness of ethical issues related sa pag-use ng AI, such as yung mga plagiarism, critical thinking, and academic integrity when utilizing AI in complete academic tasks. Sa practical application naman, this domain examines student familiarity with the practical use ng AI in their learning activities such as generating ng flashcards, mag-create ng summary ng PPT, and producing practice questions for review and study enhancement. To ensure the instrument validity and reliability, the questionnaires underwent content validation by expert in education and technology who ginasas nila relevance and clarity of each item. And a pilot test naman was ginakandak siya small group of students with similar characteristics to study participants. The results were analyzed to determine the internal consistency of the instrument using the appropriate reliability coefficient. So the final version of questionnaire was refined based on the feedback and statistical result obtained from pilot tests.
For the advantages of achievement tests, it is an important tool in our research because it objectively measures the students' knowledge, skills, and competencies. It provides a standardized way of assessment which helps minimize the personal or subjective bias from the researcher. It also produces quantifiable data, meaning the results are in numerical form, so they can be statistically analyzed. This makes it easier for us to compare the performance of different groups or to see if our interventions was effective. Lastly, it has a diagnostic value. It helps identify both the strengths and the weaknesses of the learners. This is very useful, especially in research that focuses on improving teaching methods or evaluating curriculum effectiveness. So next, for the disadvantages of the achievement test, so although achievement tests are useful, they also have some limitations. First, they have limited scope of measurement. These tests usually focus only on cognitive outcomes like the knowledge recall or problem solving. However, they may not measure other important aspects such as attitudes, values, motivation, or psychomotor skills, which are also part of learning. Second, they have limited generalizability. The scores might only reflect how a student performs in a specific subject or situation, but not necessarily their overall ability or intelligence. So we can't assume that high or low scores represents the learner's total capability. And lastly, there's a potential for misinterpretation. Some researchers might overinterpret the results, thinking that test scores completely represents learning or achievements. In reality, they only show a part of it and not the whole picture.
For the next slide, we have the advantages and disadvantages of structured questionnaire on use of AI. Next slide, please. For the advantages of structured questionnaire on use of AI, this offers a highly focused evaluation of student knowledge and awareness regarding responsible AI use, specifically tailored to the objectives of the instructional intervention. It is also a self-made tool. It was designed to include context-specific content directly relevant to nursing practice and study habits. Its items were reviewed and validated by three nursing faculty experts, ensuring clarity and strong content alignment with curricular standards. This also has a multiple choice format. It's easy to administer and score, which is ideal for conducting reliable pre- and post-intervention comparison. However, it has its disadvantage, which is the major limitation is its self-made nature in the absence of statistical validation, which may lead to questions about its accuracy and consistency. It also has multiple choice items inherently limit assessment's depth, potentially oversimplifying cortex concepts or failing to capture the student's true, nuanced ethical reasoning regarding AI use. Also, while expert review was performed, the use of only 3 validators is a limited sample size, which slightly weakens the generalizability of its content validity.
Next, for evaluation of instruments. The validity of instruments is being evaluated through experts' review to ensure alignment with learning outcomes and curricular standards. Reliability is assessed by conducting institutional item analysis and pilot testing with a small group of students. Objectivity is evaluated through the use of multiple choice formats to reduce scoring bias, while this particularly is determined by the ease of classroom administration and minimal cost of requirements.
And this would be all for our discussion on our research instruments. Thank you for listening, and we truly appreciate your time and attention.